All right, we might get going. So welcome everybody to the HAMRC webinar, Safeguarding Your Mental Health in the Age of COVID-19. We have over 200 participants, and I'd like to especially thank our panel here today. And let me make brief introductions, and then I'll talk to the process. We have Professor Jayashri Kulkarni from Monash University, who's the head of psychiatry there at the ALFRED Hospital in Melbourne. Jayashri is an international expert in women's mental health. Professor Esti Galili, who's a psychiatrist and director of children and adolescent health at Hadassah, who's an international expert in that field. Dr. Blashki from Melbourne, who's a GP, but also a chief medical advisor of a group called Beyond Blue, and we might get Grant to explain who they are later for those people who aren't from Melbourne. And certainly not least, but last, Dr. INBAL REUVENI, who's a psychiatrist at Hadassah, specialising in women's and reproductive health and mental wellness. So, look, the order of the day is we'll have about a half an hour, just over half an hour of some toing and throwing questions to tease out some issues, and then we'll open up to guests. As I mentioned, over 200 people from Melbourne and Israel, and I'll field the questions to the panel. Sorry, I forgot to introduce myself. I'm Russell Basser. I'm chair of the HAMRC Scientific Committee. I double in my day job as head of research and development for an Australian biotech vaccine company called SEQIRUS, which is the vaccine arm of CSL, Australia's largest company. So welcome everybody, and we might get going with some questions to you, Jayashri, just about the sources of mental health trauma in COVID, and what do you think are the major factors impacting on people, and how we identify them in our friends and family.
Well, this is, I've got to be very succinct because this is a big topic, but in particular what we're finding is that women by and large, and also my colleagues working overseas in different countries have said the same thing, that women by and large are experiencing a lot of stress, anxiety, depression related to COVID. And it's coming in several forms. One is the new clientele, or the new people who are experiencing anxiety and depression. And again, women are experiencing this more than men, although both groups are obviously struggling. Then there is the groups who already had some anxiety, depression, or other mental health problems, and they have got worse. And the reasons that people are struggling is because of, first of all, fear of the infection, fear for themselves, fear for their family, about, you know, whether this is going to be fatal or what is happening, particularly fear for elderly relatives, because we have seen worldwide that this is something that's affecting the elderly very, very badly with outcomes. Then there are fears about what will happen afterwards, what will happen to my business, what will happen to my society in terms of a return. And again, women experience this quite badly because the casual workforce, or those who are in non-secure employment, are often the ones who experience being laid off or sacked or redundant quickly. And so financial difficulties are also an issue. In the mental health sphere, we're also having problems with lockdown. Again, more women than men, because lockdown has involved having freedoms curtailed, and in many countries it's about not being able to leave your house. And so for many women who are in violent relationships, this has accentuated a number of those issues, and we've had a number of cases of extreme violent responses and in fact danger to life and limb. So, you know, there are a number of different categories. I do talk about the vulnerable, and then of course the new vulnerable, and then watching to see what happens with the responses to stress and whether that translates into new mental illnesses or even the beginnings of new mental illnesses, so that we need to intervene to prevent that happening, but at the same time also help those who are already have a mental illness and are being in a situation that's worsening.
Do you have any information or data on the magnitude of change in for instance, you mentioned domestic violence. What sort of problem is it in Australia, and maybe if you have any insights into different countries?
So again, looking at women's mental health, so the data that we have is for Australian data, and particularly we have our own surveys that we're looking at it in Victoria itself, and we've seen a 12-fold increase in reported domestic abuse with violence, and this is a 12-fold increase just in the last 2 months. So that's local data, but serving as the editor for Women's Mental Health on the Frontiers journals, I'm seeing a lot of trends that are similar in the rest of the world. Certainly my colleagues in Europe, particularly in France, have also described a significant leap in the number of assault cases in that country. We've got reports coming through of increased domestic violence from India, where the COVID percentage of population affected and numbers affected is enormous. So from all of these different countries, we're gathering a picture that in fact the violence increase is related to the lockdown situation, but also an exacerbation of existing anxiety, stress and depression. And also, and I neglected to say this, an increase in the use of alcohol and other drugs that you can see as a kind of self-medication, but those rates of intake of alcohol and street drugs has increased, and that leads again to disinhibited behaviour and therefore violence against women, but also children. And I wonder if Esti has more to say about that from the adolescent psychiatrist's perspective. But this is a picture of women across the globe are experiencing all of these outcomes even worse than their male counterparts.
Thanks, Jayashri. Esti, we might move to you. And can I just remind people, if you'd like to post questions in the chat box, in the chat function, please do so at any time, and we'll cover them as many as we can later on. So Esti, your interest in childhood and adolescent health is really important here, because many people have children they're dealing with, trying to homeschool them, who are socially dislocated. Can you talk to us about some of the challenges and how we recognise when they're serious and how we might help our kids cope with the current situation?
I first want to say that we are actually, we got acquainted with the COVID-19 not a year ago. I think varies between half a year to 9 months, depends where you are on the globe. But we are realizing that it does have a very significant effect on our life, and probably will have a significant effect on the world we live in for years to come, whether economically or socially and otherwise. I'm not sure how it will end, but I'm certainly sure that it does request to be very attentive, very flexible, and to acknowledge all the ramifications. Yes, I joined Jayashri by realizing that women, acknowledging that women, children and minors are very significantly affected. And I'll say it now, I'll mention it again, that we're not equal. People that have sound economic or cultural or educational backgrounds and comfortable living situations are doing better than certain minority and certain people that don't have any economic security or normal housing and so on and so forth. I wouldn't say research, because I think we're in the midst of doing surveys, if anything, and they're very impressionable, and it's kind of, we're doing it as it has happened. And you have to realize that the people doing the surveys are not objective. So it's kind of, but anyway, the impression is that it does increase the mental health issues within children and adolescents. At any given times, they have a higher rate of emotional issues than adults, but it certainly has grown now. And because understandably they absorb the anxiety from their parents, from their surrounding, but at the same time there's school closure and there's social distancing, which lead to a loss of so needed, so important structure and social contact. I think structure and social contact are probably needed for all, but they're crucial for children. And it basically means that their support systems are not in place. And there's actual reduction of all supportive services. And even though we adjust our services to online interventions, it does lead to increased demand for services and inability to meet it, and an inability to utilize it by all. I'll mention it again in a second. So vulnerable communities and vulnerable individuals, and again, Jayashri mentioned it, are being hit much, much harder. Children from poor households with physical or mental disability have a harsher reality to deal with. Forget the fact that they're more in danger if they would get infected by the virus, but as it is, they have more things to deal with. And then not all children have computers, not all children have smartphones, not all children have a privacy where they can carry intimate discussions. And academic and therapeutic services are only partially being offered. And the main symptoms that we see with children are obviously due with sleep patterns, regressive behavior, aggression, feeling of loneliness, and more self-harm. And from previous experiences with previous pandemics, these changes will stay for the years, at least a few years to come. And there is a vicious cycle in the household. If the mother is being abused or the mother is depressed, it certainly affects the whole household and the children. Now, the children have, apart from therapy, limited access to other support venues that could help them cope with stress. And I mean, children need friends and peers, and children need play. Play is one of the best methods to develop survival skills and actually resilience. And when that is limited, again, talking about vicious cycles. So a few other points to throw into the mix. That at least in Israel, the virus comes with a stigma and shame. People that are being tested positive feel that they have to endure the accusation of not being responsible enough, one, is infecting other people close to them. And people feel somewhat ostracized and some lepers-like. That's one. Two is professionals, meaning us, have challenges in offering services to young people in new circumstances, inpatients that couldn't see their families for weeks, day treatment patients, whether they can come by bus or their private car is a big issue. And whether young children wear or don't wear masks, every diagnostic testing session that takes 2 to 3 hours exposes all present to a possibility of being affected and so on. We have to deal with staff that has been ill or has to stay at home because other family. And last but not least is all our clinical teaching of psychiatry, psychology is, I would say, being very partial. So just two positive things is that for some families, time spent together has been beneficial for the family dynamics. And INBAL will talk about it more, Dr. REUVENI, but at least there's one study that I'm aware of that at the beginning, which is a few months ago, it seemed like there's a little bit of less postpartum depression. Again, maybe because the families were kind of held together, but I'm not sure whether it's a one-time thing or whether there's other effects that support it or not.
Thanks, Esti. So lots of threads there to think about and follow, but what I might follow up is your comment about trouble seeing or the challenges of seeing healthcare professionals and INBAL, especially women having kids and the challenge of delivering kids and prenatal care and postnatal care. Can you give us a sense of some of those things that you're seeing and you and your colleagues are grappling with?
So do you mean in healthcare workers or in general?
Yeah. No, for women who are pregnant, and you're interested in the issues of pregnant women and the mental health impact on people in that position, and I guess all the loved ones around them.
So as Esti said, it's exactly what we see at the beginning of the pandemic. There was, some people perceived the lockdown and being home with their families, where the family dynamic is positive, is a good thing. They said, oh, it gives me a chance to slow down, to be together with my family, to get some more support from my close family and nuclear family. But I feel that as the times goes on and the pandemic continues and there is a second wave and now maybe third waves and the winter is coming, then we see more and more women reporting distress and feeling they're, again, vulnerable to more mental health changes and anxiety and stress. And in pregnant women, this affects not only the woman itself, but the fetus and the children in the household. So this is a very crucial time point to identify and intervene these mental health issues. I think what we see, and I must echo Jayashri's point about domestic violence, which we see in women, and even if you think about women not coming into the clinics, but we are talking with them by Zoom or video conferencing in their homes, how free are they to report what's going on in their home? How can they say when the husband is in the next room, what's going on really and how we can help them? So that's, I think, an important point to just think about when we see those patients. The other thing is we see women, and I think one of the most important things about pregnant women is social support. And this is a very important thing that can be eliminated when we are in a lockdown, when we are only in our home. And of course, when the extended family in Israel, the extended family is a very crucial support system for women. And the women don't see their families, don't see their elderly parents. And we see this, the women feel this, and the women feel this when they come to give birth in the hospital, when they can only have one visitor available for them when they come in. And again, as time continues, we see this also in the postpartum period. Women are left at home to deal with the daily stressors of raising a very young child alone, without their peers, without hearing how other women cope, and without having a mother or an aunt just instruct them on how things should be done. And I think this is a very important point, that we can also intervene and maybe think about solutions that can enhance social support in our society, wherever it is.
So what sort of things have you been trying? It sounds like you're doing things to try and overcome that isolation. What are you trying? What's working? What's not working? Do you have any feel?
We are trying. We've been learning, I feel like, all the time. This has been only, as Esti said, 6 or 9 months, so we're learning as it goes. I think we are trying to help reach women at their homes as much as possible. We're trying to make maybe group meetings through the Zoom, so women can see they're not alone in this distress. There are other things. And again, as the lockdown as the restrictions lessened, so some women return to their older support group, and we are encouraging that. encouraging going back to therapy if you had someone, therapist that you go to. In whatever way you can, just try to find your support groups. And then we provide short-term psychotherapy for those women, just to try to give them a place to ventilate how they feel, and just give them support and some instruction about how things should be going on during this time. And I just want to say something again, as Esti said, as for the children, for the women, postpartum structure is a very daily routines, and structure is a very important thing. Waking up in the morning, getting out of the pajamas, opening the window, seeing the sun outside, and so on and so on is a very crucial point. And sometimes we just have to say that, and that makes a big change.
Thanks, Inbal. Grant, I might sort of ask you a few things. You're a leading clinical advisor to Beyond Blue, and maybe you can help our international audience who isn't in Melbourne or Australia to understand Beyond Blue, and talk about some of the issues you're grappling with, and some of the things that Beyond Blue is implementing that you think is having an important impact.
Yeah, thanks a lot, Russell, and thanks to HAMRC for organising this. I was reflecting on the chat with Jayashri. I think I'd prefer to be in Israel and going for a shawarma down in the old city, or hopefully soon we'll be getting across there in not too long. But really nice to be with some of my learned colleagues on Zoom. Now, Beyond Blue, for those of you who aren't from Australia, we're sort of leading national not-for-profit mental health organisation. We focus on depression, anxiety and suicide prevention. Started in about 2000. It's a big organisation, about 300 of us work there. We have a support line, like a phone service that gets a couple of 100,000 contacts a year. Our forums, our chat forums have had 1.3 million people chatting away online to each other, or they're moderated forums. And particularly active during COVID. And we've been commissioned by the government quite soon after COVID, sort of about April, they tapped on our shoulder and went, can you set up a COVID mental health website and phone line? And that's been really incredible to watch how the organisations had to develop all this stuff really quickly. So we're hoping that, you know, at that sort of population level that we can try and help people at the moment during quite a time of crisis. And I should say, most of our worlds have shrunk. You know, my wife and I were joking, you know, we'll go, oh, it's really amazing. The other dog finished her food before the other one. Just, our worlds have become very little. And now you remember that this drama is being played out all around the world. And our hearts really go out to you in Israel. We just wish you well during this big challenge. A couple of points I'll just make. I've been fairly active as a GP and also in the media, trying to give people some just common sense sort of GP approaches during this time, because people's lives have been turned upside down, as Jayashri said. Really simple things like keep routine, get dressed in the morning, activity planning, you know, make sure you get enough sleep. Don't stay up all night watching Netflix. Be your best self. You know, if you're feeling unsafe, we've got various phone numbers here, you know, 1-800-RESPECT. Lay off the alcohol, pretty tempting to get stuck into that. So before we get into any really clever psychological stuff for the more severe end, we're trying to give people just some basic skills. And to be fair, there's a whole lot of people who've never really thought about their mental health, who suddenly found themselves out of a job and gone, what the hell just happened to my life? And that's what I'm seeing as a GP. And they feel like they've just been sideswiped by a truck, you know. We mentioned women absolutely at risk. I'd like to just mention two other groups. The young people, it's very hard for at the moment. I don't know what it's like in Israel, but you know, they're in their early 20s, they're finishing uni or their trade, they're just about to launch into independence, and many of them are back at home now in a pretty small life, not really sure about the future. The other group I just mentioned are the elderly, who are fairly terrified. You know, in Victoria, in Australia, the aged care sector's been hit really badly. And, you know, they've lost their confidence, even those who aren't in the aged care centres. you know, as they get older, they're very dependent on being able to keep pushing themselves and sort of going for walks and being out and about. So lots of work to do. And we're just hopeful we can, you know, hold the fort and contribute to people while they get through this really difficult time.
Thanks, Grant. Jayashri, one thing, when we had a call earlier, just to set this up, you mentioned about the challenges of grief and, you know, so many people dying. It affects everybody. Can you help us understand some of those observations that you've made and some of the things that we might need to sort of move towards to try and help ourselves and patients?
So in particular, the death rates in Australia have been, well, they've been relatively small compared to other parts of the world, so we're fortunate in that. But it is the elderly who have taken the most severe blow in this. And there's several parts to that, in that often the deaths have been in isolation. And so again, what that sets up is a recipe for disastrous grieving, because people have been denied the possibility of sitting with their dying mother, elderly mother or father or other relative, to allow that process of saying goodbye and feeling that they have done everything they can to help their elderly relative. You know, dying is a part of life, but unfortunately that has been denied because of the isolation rules. The other thing that then adds more to that is the funerals. So, you know, in every country, in every culture, there are religious and cultural methods that allow a more formalized ritual grieving for the deceased, and it does help to alleviate that kind of sudden life and then sudden death and nothing, you know. And so again, because of the lack of, say, group togetherness in a funeral setting, that has been another issue. And added to that is the healthcare workers problem, because in particularly in the US and other places where the intensive care unit ventilated beds became very scarce commodities, suddenly there was a moral dilemma that our healthcare workers had to face, which is who should get a ventilated bed, and therefore who should live and who should die, and make these decisions on very quickly. So several aspects of all of this have led to anger, to isolation, to despair, and to a sense of unresolved or atypical grief in a number of people, particularly in such places as aged care homes, where sometimes there's a guilt about putting one's elderly relative in a care situation. So you kind of hand pass the problem to somebody else. And then those places became real sites of infection, rapidly spreading through the elderly community. So you have all of these issues in those who are remaining. And that's grieving for the elderly. It's even worse when somebody who is dying ahead of their expected life span dies. And of course, that sets up a number of other issues about how did they get the infection? Was it my fault? I didn't do the right thing by not isolating enough, so I caused this death. And then you have a number of other, and anger expressed towards our hospitals and healthcare workers. You know, you did not do enough. The government did not do enough. So my child, aunt, uncle, whoever suffered the consequences. Now I'm angry with you and I want some retribution. So these are a number of things that are playing out in somebody who perhaps has not had a mental health problem. And of course, in somebody who's already experienced trauma, already experienced loss, is going to experience these things in an even bigger way.
Yeah, thanks, Jayashri. And Esti, I presume the very similar themes globally in Israel. And kids, I mean, that you know, the way we grieve in Judaism is I've always found profoundly strengthening for the family, and the isolation of kids and how can they be helped when their grandparent passes away, Esti, and what do you, or even close family members, not just elderly who die, unfortunately, what sort of issues are you finding? Are there is there work you're doing towards trying to help children and adolescents cope with loss in a way that we've never had to face before?
First, I want to mention something, Jayashri, that you said the cutting of the routine between grandchildren and grandparents has been very significant in Israel. A lot of couples relied on their parents and their grandparents to look after the children at least part of the time. Children and grandparents expected that relationship, and most families that have it has been a very fortunate experience. And within one day to the other, it was cut, and young children couldn't fully understand the meaning of it. That's number one that I just wanted to put in. The second is the parents' preoccupation with livelihood, whether it's protecting themselves and the household from illness, or whether it's being able to support. A lot of people have lost their jobs in Israel. All that affects children. And again, as I said before, playing with other children is one of the best ways for children to survive. So they don't have that available. They don't have the school structure available. And then you hear the children get up at noon for one Zoom meeting with a teacher. And again, with the ones that have the Zoom meeting, with ultra-Orthodox and a lot of Arab children, they don't have the platform to be able to do even that. So what do we do? I think what INBAL said, what Jayashri said, we do what we can do, and I think Beyond Blue is doing the same. I mean, we do what we can. The very, very fundamentals of get out of bed, change your clothes, have breakfast or something, talk to the people around you. Social media is a comfort, but also it is very limited. It has addictive elements in it. It can affect your self-esteem. So I think that's what we have been saying all the years about trauma. It's good to have a plan, but you have to make sure that you tailor it to the right person you're dealing with. There's not one answer that applies to all. So we try our best to listen. We try our best to do reality check. And we try our best to be, for ourselves and for our patients, to be optimistic.
Okay.
It's very interesting, if I could just interrupt here, that in fact, as a country in Australia, we didn't really talk about mental health very much. There's a strange sort of Australian ethos, which is she'll be right, mate, and a very pragmatic approach to problems, and not so much the self-reflection or thinking about matters psychological at an Australian level, perhaps. I might be going out on a limb here saying this, but it's very interesting that in this pandemic, suddenly the whole mental health stream or consideration of mental health and resourcing into mental health has suddenly become a part of the battle in this pandemic. Of course, infectious diseases and vaccines and all of the things we need to do to assure life comes very, very first, but not far behind is mental health. And that, I think, is an interesting change in our country. I think some more of other countries have been previously more mental health enlightened, but this is also a bit of a revolution.
Absolutely. INBAL, can you comment on, is there a revolution in the identification and acceptance of mental health as an issue that we need to talk about a lot more in Israel?
I agree with Jayashri. It's interesting. I think also in Israel, we're talking about resilience, in the face of war and terrorism as very valuable and worthy of, but now we can see, I think people are more able to talk about the vulnerability. We have maybe the elderly who are more concerned about the health issues, but the other parts of the population are actually concerned about the problems in economics and, again, and their occupational problems and education and the social problems that that we endure, but then we can talk about our vulnerabilities, how we feel being alone, being away from our friends and from our families. So I think this may have opened up this discussion more.
I just
Yes,
Sorry, Ross.
just one sentence.
You go, Esti.
Esti, you go.
Optimism aside, we have not seen yet channeling of funding into mental health, unfortunately, in Israel. But I do think that what is playing here is a bit of taking aside the stigma. Because if you react to something that is a collective experience, whether it's war or trauma or pandemia, then you're still normal. You're not labeled as mentally ill. It's okay to be anxious or depressed or to have difficulties with your children at times like that. And I think that helps a lot the ability of people to actually talk to their GPs, we're going to you, that they have problems, and then to see whether it can be answered on that level or they need to be referred to more professional kind of help.
So Grant, segue to you.
Just like to agree with Esti, and one of the things we've done, and I see they've just put up our phone number for Beyond Blue, is you don't have to have a mental diagnosis to ring up. Yeah, and we've been very much encouraging people, listen, be preventive if you're just feeling a bit stressed at the moment, or you're in a pressure cooker household with your, you know, partner at the kitchen table working and 3 children home from school, and you, or the other group, which we probably should mention, the isolated single people at the moment who in the lockdown in Victoria are really finding it extremely hard because, you know, if they're sticking to the rules, it's literally months and months now for many of them of just being on their own. And they can have a little Zoom call or a text from a friend. But we're pretty concerned. In Victoria and Australia, there's been some new changes coming up where they can open up the lockdown bubble and connect up with a friend, which I think is really important. So I think I would agree with those comments, though, that Esti said about the stigma, and Jayashri as well.
And Grant, just before we get on to the questions, we haven't touched on, but maybe just a brief comment on medical interventions, the role of medications, and as a GP treating people, how are they helping you? Are you avoiding them?
Yeah, look, in Australia, they have the policymakers, I must say it's a tough job, but I've got a lot of respect for them. And they've done a couple of good things. First of all, they realised that from previous pandemics, a lot of the fallout is that people are scared to go to the doctor for just basic medical care. So I know you've got a background as an oncologist as well, Russell. You know, people don't go and get their preventive tests done. They go, I'll do it after COVID. Or they don't get their blood pressure or their heart disease or their diabetes checked. So there's been a big push to try and encourage people to use telehealth, which is new, for GPs to be accessible, including myself, on telehealth. And we've seen this acceleration of a funding model and a way of people contacting the GPs through that method. In terms of medication and psychological treatments, what I'm noticing is that actually we're getting quite a waiting list, and this is a broader discussion about how do we match severity of illness with the intensity of care. So if we send people with mild stress and use up all our top, 16-year trained PhD psychologists, they're not there for our really complex people. So we're still looking, COVID sort of pushed us to take a step back and look at the whole system and if we're actually using the services in the way we should be.
So look, thank you all. I want to get to some questions. We're not probably almost certainly not going to cover all the questions, but I'll give it a go. The first one is, I have seen major issues of loss and abandonment in clients. I believe that social distancing triggers memories of abandonment, despair and paralysis. COVID-19 threatens poor original attachment relationships. Can you please comment? Jayashri, do you have?
I can say a bit, but I think when we talk attachment, we're in the area of psychodynamic therapy, and Esti is one of the leading world experts on this area. But certainly I agree that we are seeing, for example, simple example, I had a woman who has a considerable history of trauma and loss in her background, and she said that she takes it personally when people move off the footpath when she's walking. They move to give a distance of social distancing, and she takes it personally. She says they are seeing that she's not worthy, and therefore they're sort of neglecting or rejecting her, and that leads her to think about self-harm. So, you know, it's almost as if, as one of the people said, you have a chasm you have a crack in your psyche. This creates a chasm because you have external factors. It's also very hard in therapy to also convey some of these. If you're dealing with somebody wearing a mask and you're wearing a mask, and they can misinterpret what you're saying because they can't see your expressions and so on. So certainly we would agree that there's increased issues of loss and abandonment, but I think it'd be nice to hear from Esti on her expertise in this area.
Sure.
The truth is, the good thing about psychodynamic that we always say we need time to reflect. But I think what comes to mind right now is an adolescent that is in therapy in one of our units, which has significant issues with actually being internalizing positive parental figures, and as a reaction to that has developed the split between a good and a bad parent. And on top of it all, and she's been treated for 7 months, and it's a long process to build a trust between a patient like that and their therapist, so they'll be able to take it in. And the therapist abruptly had to go for family reasons abroad, and she couldn't be treated, and then she had to go into isolation, and all that with someone that has real attachment issues, real negative internalized maternal figure. They experience something like that as total abandonment. Even though you rationalize the whole situation, you cannot provide to some of the more hurt and damaged patient the security that they need and the ongoing stable support. You can't guarantee that you'll be there twice a week. You can't guarantee that you'll be healthy. You can't, so in a way, you're not providing the therapy in what we call the therapeutic environment that is supposed to give a certain kind of security. But I could ramble forever about that, so we'll stop here.
Thanks, Esti. We might move to the next question. They're coming in. Thank you, everybody. Look, a question, it's a bit long. I'm not going to read the whole thing out, but it's about the positives and negatives of social media. And the question in summary is, are we wasting our time and tempting more anxiety, depression with the increasing reliance on social media? And what responsibility do organisations like, I guess, Facebook, Instagram, have to stamp out the very negative effects on people? Maybe INBAL, maybe you can give a view, and then Grant.
I think the view about social media, I feel, is more complex. The discussion should be more complex, especially now when we're, again, we're all talking through Zoom across continents and oceans. So I think social media has very good aspects, especially today, and especially for the young people who are used. This is a mean of a true communication for them. To relate and have relationships, but also we have, it can be a place of stress and anxiety. People are exposed to stories about illness and loss and grief in a there is nothing separating between them and the stories. It could be very personal, even if you don't know the person itself. And this is for adults. I mean, I think for younger people and teenagers, maybe maybe Esti can elaborate about the effects of peer pressure and things that are going on there. But again, I think we should see it in both ways, and as everything, it should be used in a good manner, in a good. I'm missing the word, but just right, and then we can use it to socialize and to get support, and not overuse it and make it the only interaction we have.
And Grant, Beyond Blue relies on the social media space, I guess. And do you think, though, the organisations who run the social media platforms have responsibilities in this sphere? You're on mute, by the way.
Here we go. It's really interesting at the moment because, you know, the big social media is this massive social experiment on human beings, and particularly our young people, in how that influences their identity to be plugged into this sort of scrutiny the whole time. For those who are in Israel, they might enjoy that our Australian treasurer is busily trying to tax some of the big social media companies, but that's another story. But what I've done with a lot of my patients who've fallen into that sort of algorithmic whirlpool of nihilism that you can fall into, if you go onto YouTube or the suggested videos, you can get into a very bad headspace, which is a bad mix with if you've got depression or anxiety, it doesn't help you. So I've been encouraging them to curate their social media, to set a time, say, listen, you don't need a minute by minute blow of what's happening with COVID. It's not going anywhere. Let's say 6 o'clock, you're going to look for half an hour, or at 9 o'clock in the morning, and put it away. And for some of the young people, suggesting they plug in their phone outside the bedroom so they're not getting pinging and social media all night. That's making them exhausted. The other thing I'd say to you, on a forum, go on a moderated forum. I mean, Beyond Blue is one of them, but there's others. But all the posts are checked so that you don't get trolls and really destructive, horrible people who, you know, say terrible things to people online. So I think can be good, but I think needs to be curated and used really carefully.
Thanks, Grant. There's a question about the long term and the changes coming to society. People who died, you know, elderly, people who we're finding out there's 10 or 15% of people with COVID who are chronically unwell now, and a lot of the burden falling on especially women in particular. How do we see the future of caring for people who are not as well, not well? Maybe Jayashri, can you maybe make a few comments?
So I think that, you know, what we're going to be left with, even once the acute phase of the pandemic is finished, is really critical and at the moment unknown. But as this particular author says, there is really a fear that real fear that there's going to be people who have more chronic forms of mental ill health, and included in this question is depression, chronic fatigue, sleep problems, and so on, as well as absolutely the neurological consequences. And there is going to be an increased burden of care. And we know that women in families tend to have a greater share of that burden of care. So again, what we're hoping for is a consideration of social reform in the way we fund social reform groups or social caring groups. And I'm hopeful that there is some interest in looking at this because, for example, it's an aftermath of increasing resource funding for mental health, because clearly we need armies of therapists and counsellors and several layers. You know, psychiatrists will deal with the most severely ill, clinical psychologists similarly, and so on. And then you've got primary health sector, but you need a large number of other therapists. So just like they are being resourced to some extent, not completely, but to some extent, we're also looking at things such as, in Melbourne, there was a study done looking at the division of labour and unpaid labour, which is this form of caring, and whether there are ways to remunerate some of these things, carers' pensions and so on. So it is easier in countries where the social programs are sophisticated or enlightened, but it's going to be very, very hard where those kinds of provisions are not there. And we're certainly trying in the women's health policy organisations that I'm fortunate to be part of to push this as a major future agenda.
Thanks. I might go to the question that's a bit more medically focused just for a moment. We only briefly touched on it, and there's a question from Mind Medicine Australia about the current treatments for mental illness not being so effective, and isn't this a good opportunity to start innovating in medical treatments? I don't mind who answers. Anybody feel like tackling this one? Grant?
I might just mention in relation to that, Beyond Blue just put out 2 reviews, one for depression and one on anxiety, which reviews all the treatments. It's for a lay audience, it's free online, I'll post it on the chat. But it's great, we got Melbourne Uni to spend a couple of years looking at medications, psychological treatments and complementary treatments, and then giving it, you know, quite a simple 3 stars up, 3 thumbs up or question mark. So just as a backdrop, there's quite a lot of information there on what's been looked at for depression and anxiety. But there might be members of the panel, maybe Jayashri or someone else, who'll be more learned than me about the new innovative sort of things that are happening.
Look, there are lots of reasons to start exploring the different new treatments for depression, anxiety, PTSD and others, because I like to think of this as a biopsychosocial causality, and therefore we need biopsychosocial treatments. And a lot of the focus has been on the psychosocial treatments, and that is necessary. But there is obviously going to be a section where the biological change in neurochemistry, neurocircuitry is certainly an issue, and you're not going to be able to readily, easily shift that with therapies. So new therapies are always critical. New therapies to be properly trialed is the underline that, because, you know, we saw, for example, the ketamine story, which is an interesting new development of treatments, in some instances was not properly trialed. And of course, none of these substances are simple substances. They can be very effective, but they need to be properly clinically trialed. And of course, we would hope that this is going to be happening. We urge the NHMRC, which is the Australian National Research Organisation, to look at funding clinical trials so that experts in the area can do it with safety. And yes, we need new treatments. Absolutely, we need new treatments. And certainly I am aware of the psilocybin and other potential forms. So let's hope that the clinical trials show us what can be done there.
And Esti or INBAL, any observations in Israel of trends in the medical side of psychiatric care that are emerging through the pandemic?
Just want to say I agree with Jayashri about testing those compounds, you know, in depth before we use them, and we put hope in new compounds as to be saving us from anxiety, from depression. But especially in times like this, we saw what happens in internal medicine with the hydrochloroquine and other stuff. This is the time not to rush into new compounds and to make sure we put them to good trials before we use them.
Point well made. Esti.
I don't have much to add on that, because children and adolescents are protected from exposure to new techniques, and we actually wait for the adults to try them on. We are hoping for better biological answers for depression and anxiety, but I do want to mention something from before that's very important for me. The social media carries with it for young people also a lot of seduction with different games, including games that encourage self-harm and self-exposure. And it is highly important that parents, while appreciating and respecting their children's privacy, also are very aware about what the children do with their phones and iPads and computers, and make sure that they're not exposing themselves to predators and to different games. We have seen children that came to the emergency room after doing different challenges that were offered over the internet. So I do think that things are very important to be aware of. Sorry.
No, that's pretty grim. Esti, there is a personal question to you. I think some practical advice. Hi, Esti. What should grandparents say to grandchildren to help them get through this situation?
I haven't been able to hear your question because the sound went off.
The question is, what should grandparents say to grandchildren to help them through COVID-19?
I think the good thing about being a grandparent is that you know that even difficult periods come to an end. And we are very aware that these difficult times are temporary. And it's a strange thing for me to say it, but it is real. And so what you say to your children and to yourself, that we are experiencing something new, something that is global, something that demands different kind of restrictions. But on the other hand, we know that we'll learn something new from this experience and grow as we come out of it. I am not being sentimental. I really know it as a fact. I truly wish, like everybody else, that the pandemic wouldn't be hitting us, but I do know that we'll come out of the other hand and damaged, but yet knowing new things and being able to do things that we weren't able to do before. So I think it's very important to let your youngsters know that it is a phase.
That's a nice optimistic sentiment. Grant.
Yeah, I just wanted to reiterate that I think as senior people, we do carry the hope a lot for the communities. And I mean, Israel's had to deal with quite a lot of traumas over the years. I think a lot of Australians are a bit shocked, the young people. They're like, what? Everything's supposed to be fine. So, you know, I think we have got an opportunity to carry that hope, not a Pollyanna hope, but like a mature hope that, you know, these things happen in history and we will get to the other side. And the scientists are working right now on sorting out vaccines like you, Russell. So, you know, I think that's quite an important thing, that we maintain that hope budget when we're talking with young people.
Yes, it's an interesting balance, isn't it, to getting us through that medium term. It's months, it's not a few days or weeks, and we're going to hopefully get to in a year or two a vaccine or enough immunity that we can start living more normally. But it's getting our families and ourselves through that. And one other thing we talked about before, I don't want to finish on, there are some other questions, but I don't want to finish negatively, but talking about self-care, we haven't raised, I mean, Grant, you've talked a little bit, you know, you've alluded to just some structure and, you know, some rules like, you know, reduce the alcohol and things, but maybe, INBAL, maybe you could comment, self-care, how do we look after ourselves in our profession, in our lives? Is there anything else that we haven't touched on that you would think that we should at least mention?
Again, I think we need to go to the basic routine and keeping structure, looking around us to look for support, social support, and resources, have them available for people if they need any help, as much as possible, as accessible as we can. And I do want to finish off with an optimistic point, as Esti started off, and say, I think it's a chance for us as healthcare workers and mental health professionals to reinvent ourselves, to provide care that is more accessible, maybe reaching people at their homes in their natural environment and giving them, you know, access to healthcare that is more, maybe even more easier than it was before.
Grant, were you going to say something?
Yeah, look, I was just thinking that, you know, really just to reiterate that optimism point, I don't have anything extra to add on.
Esti, you were going to add something?
I wanted to say that we all have also inner resources of creativity and we have a lot of time now in our hands to get in touch with them. Music, art, playing, all these things are available to all of us, and we should encourage that inner ability to grow from that. Jayashri?
And Jayashri,
Yeah.
can I? Yes.
I think we must not underestimate the power of conversation for ourselves and for our patients, that just being able to put into words what is sometimes a very sort of uncomfortable but unnameable emotion, particularly anger. It's really critical to be able to express that and to have somebody to hear that. For those of us who are lucky, we're still in loving family situations, we have that inbuilt. But for many of our clients who are not in such a wonderful situation, then that's where the therapists and counsellors play that very important role of just being able to hear, contain, share, and stand alongside the person who's struggling, because we are all in this together to a large extent.
Thanks, Jayashri. And look, that's a very powerful thing, isn't it? None of us are alone here, and neither we or our patients are alone. So look, there's so much more we could talk about. We've had to cut it short, and thank you to the conversations in the chat, to the audience. Thank you in particular to the panel, to Jayashri, Esti, INBAL and Grant. It's been wonderful. We could go on for another 4 or 5 hours if we just had the time. So thanks all, and I hope you've enjoyed the seminar. Goodbye.